love on the People Station, Majic 102.1. Charlie Wilson featuring Smokey Robinson. Dr. Hardee, fibroid specialist at Houston Fibroids, is back with me to tell you what percent of women with fibroids will UFE successfully address their symptoms.
The best studies available to date, at 1 year interval, 92% of women, their symptoms are completely gone, heavy bleeding or bulk-related symptoms. Now, long-term, longer than 1 year, you're talking 5 to 7 year data. It goes down slightly from there, typically to the kind of mid to high 80s. If you do a UFE procedure on a lady who's 30 years old, they still have a uterus, obviously. They can still grow new fibroids. So the recurrence rate is age-dependent. If you do the procedure on someone who's 45, the chance of a recurrence and having more symptoms is almost zero, whereas if you do the procedure on a 30-year-old woman, the chance of her having recurrence in their lifetime is 10 to 15%.
Okay. And what should a woman do or say if their OBGYN tells them that a hysterectomy is their only option or that UFE will not work for them?
That's a great question. It's really surprising that we still hear that somewhat, especially surprising since in 2008, the American College of Obstetrics and Obstetricians and Gynecologists actually issued a practice bulletin saying that uterine fibroid embolization was an excellent option for women who wanted to retain their uterus and didn't want to have surgery. So that's out there in their own literature, but for whatever reason, some gynecologists don't feel comfortable referring a patient. And patients are actually finding out about this procedure through friends and family who've been treated this way, through the internet and other media. Once they find out about this option, if their gynecologist just for whatever reason does not want to refer them to somebody for an evaluation, they should really seek out a second opinion. Getting a second opinion is a time-honored tradition in all of medicine and is no different for this. And they should seek out either a different gynecologist or look for a vascular interventional radiologist who does a lot of these procedures, who's very experienced in this type of procedure, and get another opinion. And they need to do their homework and get all the information and make the decision that's best for them.
Absolutely, Dr. Hardee. And will insurance cover the procedure?
Yes, this is covered by insurance. It's not considered experimental by any means. I've been doing this for over 20 years. When I first started, you had to actually negotiate sometimes and convince the insurance companies to cover it. But that time is long past. This is now a standard of care, state-of-the-art procedure that every insurance company covers.
If someone would like to come into your office for a consultation, Dr. Hardee, what's the best way to make arrangements to do that?
Well, they can either reach out, just call us on our phone number, 713-575-3686, or the easiest way is to go to our website, HoustonFibroids.com. It's pretty easy to remember. And there's a link at the top of the page to schedule a visit, and it'll take them to a web registration form. And as soon as they fill that out, someone generally will get back to them the next day in the morning.
All right, Dr. Hardee. I appreciate your time. Take care and have a blessed day.
Absolutely. Thank you very much, Kandi. Appreciate it.
There's no crumb left behind.
As Majic 102.1 celebrates Houston's Black Restaurants Week.
Oh, my goodness. The food looks and smells amazing.